with us, and I'd ask that she at least share, if Dr. Branch were here, he would give, his perspective as our county health officer. But since Della is with us, I'd ask that she share as the deputy health officer in terms of, addressing safety for congregants in general at this point in time, knowing that the CDC, what the CDC's position is about masking indoors, now that we're at the level of high transmission here in the county. So, Ms. Fletcher, would you please comment so that the public that is listening can hear from the Deputy Health Officer the perspective from the CDC regarding indoor mask wearing?
Good afternoon, Council Chair and Council members. So Baltimore County unfortunately did enter the high transmission CDC guidance within the past week. As Mr. Benjamin explained, we've had an increase in 23% of inpatient hospitalizations the past week. The numbers are trending in the really, really wrong direction. So CDC guidance for high and substantial transmission, the guidance is the same. Vaccinated or not vaccinated, they recommend indoor masking and outdoor masking if you cannot maintain social distancing from those individuals that are not part of your normal sphere. So it is strongly recommended. Of course, it's strongly recommended for vaccinations, but with the Delta transmission, we also are strongly recommending indoor masking and outdoor when you can't maintain social distance. So I would appreciate that your religious institutions, all of them, do want their parishioners healthy and be able to attend services. So anything that can be done to encourage to follow those CDC requirements is really greatly appreciated, because that does help to decrease the transmission. Thank you.
Thanks. That's very helpful, Ms. Leister, and also thank you, Ms. Rogers. Thank you, Mr. Chair. I just wanted anyone who was listening to be clear on the CDC guidance and what we're doing here in Baltimore County. Thank you.
And again, the level that we are now in the last week is high, which is red. If you go out on the CDC website, you will see it. This is the highest level of transmission, and we are designated as a high transmission region at this point, at being at a high transmission red now by the CDC, and that just happened over the last week.
Okay.
Thank you.
Sure. Any additional questions or comments from any of the members?
Mr. Chair, if I may.
Yes, Councilman Randall.
Sure. I want to be careful not to tread into the debate that we've had over the past year. I think my position on this issue is well known amongst the attendees of this meeting and both public and publicly as well. The county has operated without a state of emergency within the past 6 weeks, and the justification for a new local state of emergency was stated in our fiscal notes that it is to enable us to continue to receive federal and state aid. What has changed in the past 6 weeks that would not enable us to receive federal and state aid where we would need this local state of emergency? And so that's one question, and put that in the hopper. And then following on Councilman Patoka's statement, the Jewish community that attends synagogues, they're willing to take on personal responsibility in order to protect themselves. And I've noticed that amongst a lot of people throughout Baltimore County that have taken personal responsibility in the past 6 weeks without a state of emergency, without a mask mandate, without mandated social distancing, without shutting down businesses. So again, I must ask, what has changed And I know you're going to say that higher transmission rates, but this virus isn't going away. I said this before our meeting started. This virus will mutate beyond what it is now. And it's up to people's personal choice how they want to handle it. And the only thing that a local state of emergency does, unless one of the attorneys tells me differently, and I've asked the question 20 times and I haven't gotten an answer yet. The only thing that it does is allows the county executive to control commerce, transportation, and other aspects of society, which involves things like mask mandates and the other things that have been discussed. And I find it very interesting that we're on the heels of the MACO conference, which I attended with several colleagues of mine on the council and various county officials. I don't recall, except for a couple instances briefly, where one of those people in in certain events and in the convention center at Ocean City wore a mask. And then the county was also home to a golf tournament this past weekend where people flew in from all over the world, from all over the country to attend a golf tournament. And what I was told, I didn't attend the golf tournament, but what I was told is that there were people unmasked at the golf tournament. So I'm speaking on behalf of my constituents that have expressed this to me. Where is the consistency in all of this? Because we don't need a state of emergency in order to gain funding. And people are willing to take on the personal responsibility and have their own choice about how they want to treat this pandemic in their own way. And now all of a sudden, 6 weeks later, we're now voting on a new local state of emergency. So I've had a difficult time explaining to my constituents why we're voting again, why this comes about again, and I'm just looking for answers because I don't see any, and I haven't heard any over the past year. So again, I did not want to raise this as a huge debate over my past comments and how I feel about this issue, but I'm not the only one in Baltimore County that feels this way. And I'm speaking for a lot of people that have contacted me over the past couple of weeks and certainly over the past week about this issue and why we're approaching this local state of emergency again. So there was a question in there, and there's some other loaded comments that maybe somebody wants to respond to. But Mr. Chairman, thank you for the time to speak.
Well, I thank you, Councilman Crandall, and I'm going to just speak for myself as well as the many other residents and do my best to answer some of your questions. First of all, the state of emergency, as we just indicated to Councilman Matoka, it's not just about funding. It's also about giving the county executive the power to instill certain, to put certain behaviors or directives in place, like mask mandates and things of that nature. As it relates to people's personal responsibility, it's no question there are a lot of people that are personally acting responsible, but at the same time, there are many who are not. There are many who do not believe that there is a crisis. And the fact that it flies in the face of everything we know in terms of a government, in terms of public health, in terms of laws. It flies in the face of everything we know to say we as a government should not put rules in place to tell people how to behave because it's up to them and their personal responsibility. The fact of the matter is, if we don't have rules and regulations, many people will take it upon themselves to do exactly whatever they want to do. And you and I and many others would think that they're not being personally responsible. As it relates to the BMW golf tournament, it was all outside. There were a few places that people could go inside. I was there. I thought it was a tremendous boost to the economy in Baltimore County. I thought it really put Baltimore County on the map It made us all look good. It filled up every hotel in the greater Baltimore metropolitan area and filled up just about every restaurant during those times. So I was very happy about that. But as it relates to mask mandates and things of that nature, clearly we are moving in a bad direction. And I don't think anyone is ready to shut down everything. I don't think we are there. I don't think no one wants to do that. Today was our first day of school. It was wonderful to see those kids. It was great to see that traffic this morning and see all of those kids go back to school, and they were all wearing masks, and all the adults in the buildings were wearing masks, and they were taking the necessary steps to have school safely as they could. And they did not leave it up to every individual parent to decide. Fact of the matter is, we have 850,000 residents. We'll have 800 and some thousand different points of view. So that's what we're here for as a governing body, to provide safety and protection to the citizens of Baltimore County. And in some cases, whether or not those citizens want it or not, whether they want to follow the speed limit, whether they want to put on a seatbelt, whether they want to wear a helmet, whether they want to wear a mask. Some of them need direction, and that's what we're here to do as a government. So that's my 2 cents. And
Well, Mr. Chairman, I respectfully disagree. I'm not here as part of the legislative branch to tell people what they have to do and what they don't have to do.
I understand.
So I respectfully disagree with you on that point.
I certainly understand, Councilman Crandall. You and I certainly will disagree on this point. Are there any? Yes, Councilwoman Bevan.
Thank you, Chairman Jones. Councilman Crandall, I won't try to argue any of this with you because I know you're not going to change your mind. But the one statement that you make, I just so disagree with. And it just doesn't make any sense to me when you or anybody says that people have the right to decide what they're comfortable with and for their own safety and what they want to do. That's why our numbers are going in the wrong direction. Because when you see someone inside close up with somebody without a mask, I assume they're vaccinated, because you are supposed to wear a mask if you're not vaccinated. This is the problem. The unvaccinated are walking among us maskless because that's what they're comfortable with. But unfortunately, what they're comfortable with is killing people. It's killing people because only the unvaccinated are dying right now. So they're walking around unmasked. That is true. That is true. The unvaccinated are the ones dying right now and clogging up all the emergency rooms. It's the unvaccinated. And I'm sure any of the professionals that are here today will agree with that. You can get COVID again and you may get sick, but it's not killing people. It's the unvaccinated. So someone who says, well, I'm not comfortable getting vaccinated and I'm not going to wear a mask, either for their own personal reasons, they don't believe in COVID, whatever the reason is, they're putting someone else that's at risk. They're putting someone else at risk. So it may be their personal choice not to do that, but know that it's going to affect other people and not in a good way. And that's
Well, to your point, Councilwoman Bevan, before I get to you, Ms. Rogers, we're talking about a Delta variant, and viruses will mutate.
right.
But the reason viruses mutate is because they're able to spread and change and change. So as long as we are unable to all get vaccinated and sort of knock it out, then it will spread. And
right.
as it spreads, it will continue to mutate.
And the health department is still on the line, and I know that Ms. Rogers probably also has this information, but I know that there's a map within the health department that is able to identify by zip codes our hotspots. And it's green is really good, and red is like it's really bad. There's orange, there's yellow, and Todd, your district is one of the most highest districts for this right now, one of the highest. So I'm just saying. One of the highest. And Middle River in my district. And
Well,
Middle,
now, okay, so let's,
Never mind.
so Councilwoman Bevins, let's consider this. We were told everyone get vaccinated and COVID will end. COVID has not ended, it has mutated.
because everybody hasn't
And
gotten
it will continue, to mutate. This thing will be with us. I've talked to medical professionals. This thing will be with us for the rest of our lifetimes. This will mutate again.
But-
And all that this measure does that we're discussing, all that it does is give the county executive powers over choosing who the winners and losers are in terms of what's allowed to open, what's not allowed to open, who needs to wear a mask and who doesn't need to wear a mask. And what these steps that the government has taken, both locally, state, and federally, what these steps have taken has taken away certain freedoms of American citizens,
Well,
including Baltimore County citizens.
I don't think that
And
talked about closing anything. Right?
Well, but what we're doing, if voting yes on this this bill or this resolution, is to give the county executive, once again, after 6 weeks of not having it, it gives the county executive the ability and the powers under the charter to do those certain things, to control aspects of commerce, transportation, public gatherings.
Councilman Crane.
And now we're back to where we were. Now we're back to where we were a year and a half ago, when everyone said, if we take these measures and we declare it a state of emergency and we urge everyone to get vaccinated, everyone wears a mask, that this will end.
But
But
everybody,
it's not ending.
I wouldn't say
you're
that.
missing the big point. Everybody didn't get vaccinated in that window. If everyone, instead of all these.
Baltimore County's rate of vaccination is, and Ms. Leister can correct me if I'm wrong, is over 74%.
Yeah.
The rate of beds available in our ICUs is, I think, like something like 92% available beds.
Oh, I don't think so.
There's 92 beds available in ICU.
92% of the available beds in ICUs in Baltimore County are available right now.
I don't think so.
Are you
Councilman.
talking to Franklin Square?
I'm talking about beds available in Baltimore County.
Eastern Baltimore County, Todd, and that's where your people and my people would go to the hospital. Trust me, Franklin Square is overwhelmed right now. I don't know what hospitals you're talking to. GBMC, St. Joe's, who has?
It's just it's a stat for overall Baltimore County. And again, I didn't want to enter into this debate because this debate is going on nationally and it's a huge divisive issue among us as citizens of this country.
Well,
However,
I'll go on the record to say Baltimore County needs a leader. The county executive is the leader of this county. And I want a leader. I want a strong leader that's going to help us make decisions. And I think as a body, we should have that responsibility to have our leader make the decisions that he needs to make. And I know that you have people that will probably disagree with me, but I can tell you, most people were very happy with the leadership of County Executive Olszewski through all of this. They were responsive to him. They were grateful. Our businesses were grateful for the grants that were made available. If you talk to other people in other counties, they weren't as successful as Baltimore County and, helping businesses along when they had to be closed.
and Councilwoman, I will agree with you. In fact, when I posted something on social media that said that we were having this emergency session this evening, I said the county's been doing a great job.
So what's your problem?
The response is the county's been doing a great job.
So what's your
The problem is that we don't need to declare a local state of emergency to give the county executive these powers
Well, what happens?
in order to gain the funding that we've done in order to respond to the thing. We've been responding to it for this past 6 weeks without a local state of emergency.
Well, let me.
Can
Thank
I
you.
ask Ms. Rogers a question?
Yes, go right ahead.
Miss Rogers,
Yes, Madam.
if
Woman.
the county, if the numbers consistently stay in the same direction, and more people are sick, and we have to have more and more frontline workers who I'm guessing through over the last year have been paid, their frontline work. They've been given bonuses. It's been a lot of um, overtime and things like that. Would we be able to pay for that without this, or are we able to pay for that?
We have
If-
additional funds that are within the county already that
Mhm.
were provided by the state
Mhm,
and provided by the federal government to give us continued ability to address the pandemic. But I'll
mhm.
shift the conversation a little bit away from the money.
Okay.
I want to talk about the impact on the healthcare system. And I can say to you that we speak with the hospital community on a regular basis. We were talking with the hospital, Baltimore County Hospital executives on a weekly basis. And then when things got a little better, we dropped down. We're now back speaking with the hospital executives. I want to share just a little bit about the impact that this is indeed having on our healthcare system.
Mhm,
The staffing challenges that the hospitals are expressing to us, the increased utilization of the emergency rooms.
mm,
We're talking about, the numbers of individuals who are coming to our hospitals. So it's not just the hospitalizations, but I will say to you, it is the fact, the data that has been shared with us and that we track, that the vast majority of the individuals who have been hospitalized
mm.
since the surge has increased have been unvaccinated individuals. And
Absolute
that
fact.
is documented, that is
Fact.
factual. The healthcare community is sharing that. So
Right.
with increase of demand on our healthcare system, that is a challenge. It's beyond just the government and what we're trying to, address. What we were advised by our colleagues within the healthcare system is that under a state of emergency, it gives them flexibility as well on how they can address medical care. They can utilize telemedicine more. There are some restrictions based on insurance policy that does not allow them outside of state of emergency to utilize telemedicine the way they use telemedicine. I talked to my own physician about this, so I understood it. If they can have the flexibility to use telemedicine more readily, then that decreases the in-person demand on our healthcare system. So that's something totally different than the money issue, shutting down businesses, et cetera, because the demand for healthcare and the demand on our healthcare system right now has dramatically increased. The other thing that I'll say is we do have a vulnerable population here in Baltimore County. We all know, we've talked about this before, that 25% of our residents are 60 years and older. And it is unfortunate that some of the individuals that have been reported to us by the hospital community are individuals that did get vaccinated, but someone who is unvaccinated either reinfected them and now they are hospitalized, the most vulnerable who need the care. So the reestablishment of the state of emergency also helps our healthcare colleagues who are struggling. Quite frankly, this is what they tell us. They are struggling with staffing and they're struggling with increased demand, not just on the on the ICU beds, but on the emergency room services that they have to serve individuals, and to give them the flexibility to use telemedicine more readily. That's what we were advised, how the reinstitution of the state of emergency could help the healthcare community. So it's not just the government.
Right. And
Ms. Rogers, how does it help the healthcare community? The state of emergency has nothing to do with helping the healthcare community.
Well, let me get some-
Councilmember
It's spelled,
Cran-
the state of emergency powers of the county executive are spelled out in the charter. They have nothing to do
I beg to
with the
differ,
healthcare
Councilmember
community.
Crandall.
It's all optics. It's all about money. It's all about
Councilmember
control. Come
Crandall,
on.
you know, I highly respect you, but I'm going to beg to differ. I'm sharing with you with what our colleagues from the healthcare industry said to us. Number one, they've shared with us the data on the increased individuals who are coming to the healthcare system needing assistance right now. They are overtaxed as far as not having enough staff. They stated that they have the flexibility in the state of emergency. I don't know how that impacts what they do. I can only report to you what we were advised as to how that could help them as well. Now, I'm happy to go back and get more information for you and share that with you, but we were advised that there are limits on the number of telemedicine interactions with patients that they typically have. And I talked to my doctor about this, so I understood and was informed. But we were advised that that puts them in a position to use telehealth more readily if there was a state of emergency in place. That's not something that I made up. That's not optics. That's something that was reported to us via our conversations with the healthcare, the members of the healthcare community, sir. I would not.
And Ms. Rogers, I appreciate that point, and I'm gonna not comment anymore after this. But if you could share that information with me, is what the healthcare community is saying that the state of emergency does for them, I would appreciate it, because in the past year and a half, we haven't received any of that information on the
That's
count.
the first time I heard it. That was the first time that I heard it myself. But I just
Okay,
had offered that and move the
Let's-
conversation off of the money and talk about the impact on the healthcare.
Let me just say this.
and
Let me say
Mr.
this.
Chair,
Al-
Mr.
let me
Chair,
say
I'm
one
done.
thing, Councilman Crandall. Thank you so much. Our state of emergency is spelled out in our county code as to what it does. But in our county code, it does not list the rules and regulations and the federal regulations of the healthcare or the hospitals or doctors or anybody else. They all have their own rules and regulations that spin off of what we do. In a state of emergency, they have other flexibility. They don't have the right to declare state of emergency.
Councilman Jones,
State of
I have been asking the same question for the past year and have not gotten any answers as to why we need a state of emergency and what that does beyond what it allows the county executives to do. So if we can get that information, I respectfully ask Ms. Rogers to
I'm
send that along. And as I said, I'm done unless, you want to mute me again. But
To your
I
point,
just,
we're not going to mute anybody because we're all going to be respectful.
But
Ms.
Councilman,
Rogers,
so
let me
I
just say one thing that you
if
did
I had
not.
that information before, I would have given it to you. We were not aware of it. I'm just sharing what I know.
Let me tell you something. The Code of Federal Regulations is about as tall as each and every one of us stacked together. So I'm sure there's a lot of regulations in there concerning the state of emergency. But let me
if
just
you're
say
so
this.
sure of it, Councilman Jones, send it to me.
Well, I'm gonna let you Google it. Ms. Rogers, let me just say this. One of the things you did not mention, it affects each and every one of us. If something, unfortunately, God forbid, if something were to happen to either one of us or any one of us or our family members, and we have to go to that hospital, the fact that those beds are taken by people who are sick because of COVID, that affects our care. It affects whether we're going to get care. It affects whether the ambulance taking you to the hospital is going to stop at the closest hospital or if that hospital is going to be on red or yellow or alert and going to have to go to the next hospital or the third hospital or the fourth hospital. All that affects our care, each and every one of us. So it's our job to try to do our best to stay out of the hospital, because when people are there and clogging up the works, it affects everybody. Are there any additional questions or comments from any of the other members? Councilwoman Bevins?
I just wanted to add a personal note, because, sometimes you need things that hit you at home. And actually, Todd, he was your constituent. My husband's childhood friend, his entire life, is 63 years old. They've been friends since junior high school. They grew up in Colgate together. And he'd been fighting brain cancer for 2 years. Had 2 cranial surgeries, took all the therapies that he could take. And somebody came to visit one day, and the rule was, you had to be vaccinated. If you weren't vaccinated, you had to wear a mask, gloves, gown, everything, because he didn't have much time left. And he was really cheated with that last couple of weeks from his family, because somebody said they were vaccinated, didn't wear a mask, and he got COVID and he went into the hospital. And the sad part about that, most people would say, well, he was going to die in a week anyway. Well, at least he would have had his family around him if he hadn't had COVID, and he died alone in the hospital, and from somebody that actually lied and said they were vaccinated. So that's a problem too. And, I just assume if you don't have a mask on that you're vaccinated, and we can't do that anymore. So yeah, that was personal for our family. And, there are more and more stories like that. 2 gentlemen that I went to high school with, their brothers, and Todd, they still lived in Dundalk, and they died within 3 days of each other. They were unvaccinated. So it's alive and well, and people are dying, and they're going to die alone in a hospital without their family around them.
Thank you, Councilwoman Bevins, for sharing that with us. I'm certain I can tell you quite a few stories of my own of people that I know where they begged their loved ones to get vaccinated, and they decided not to do it, only to end up dying or in a hospital or walking around today with oxygen behind them. Let me just say, the reality is this, to make a long story short. As a society, we need rules and regulations. And we need rules and laws to protect our citizens. And many citizens are looking for us for leadership. They may not do something until it is a law, and then they will follow the rules and follow the law. The notion that, everything we do take people freedom away, whether we make a rule on the speed limit or stopping at stop signs, it all, quote unquote, take their freedoms away. But the reality is, this is what we have to do to have a decent society. People have to follow the rules. You have to have laws. You can't have a free for all. And that's what we do. And that's what we're doing here today. We're going to make sure that we give the county executive, that'll be my vote, power and authority to take the necessary steps. And to be quite fair and honest, he has been very fair with us in terms of his collaboration. He hasn't been roughshotting and doing it. If I thought he was not going to be responsible, I wouldn't vote the way I'm going to vote. But I think he is. I think he's making good decisions, and it's good to know that he's been in consultation with us in making these decisions. So, on that note, it's important that we do have rules and regulations, because some people are not going to do it unless it is a rule. So it can't be a situation where we just throw our hands up and say everybody be personally responsible, because many are not, and many are looking for guidance and leadership, and that's what we're here to do: provide guidance and leadership. Any additional questions or comments? Thank you, Ms. Belcastro. Do we have some speakers?
Yes, Mr. Chair, we have 3 registered speakers this evening. Our first speaker is Amy Adams. Ms. Adams.
Yes, good afternoon. Thank you, Council, for allowing me to speak to you this evening. I'm very sorry to hear. Are you guys hearing me okay?
Yes, we can.
Hello? Okay.
Yes, go ahead, Ms.
Um,
Adams.
I'm very sorry. Yes. I'm very sorry to hear about the sad stories that members shared this evening, but I think as leaders and positions that you are in, you really need to focus on the data and lead from that. I want to say thank you to Councilman Crandall for his comments this evening. All of Maryland counties are currently in the orange and red zone of transmission according to the CDC chart. And this is tracking cases. So our cases are going up. But the good news, just like Councilman Crandall said, is our hospitalizations and deaths are not. And I think perhaps he had the data slightly mixed up, but our current state acute beds of all of Maryland only have 8.6% COVID patients. So the majority of the acute hospital beds in the state are not COVID patients. And of the ICU beds, it's only 18% that are full throughout the whole state of COVID patients. So I am interested to see the data that you're going to share with Councilman Crandall to see how a state of emergency will affect hospital emergency management plans, because I believe that they all have their systems set up to react to pandemics, and they've learned a lot over this last year and a half. I want to know how the state of emergency expands the county executive's powers specifically. You know, we had the golf tournament, which I think is wonderful. It was great for Baltimore County. We currently have the state fair, which again is outside, but it's thousands of people congregating and people from outside our area coming here. So if these two events are still happening, why was the state of emergency enacted? How is it going to benefit us citizens? How is it going to affect the businesses, the citizens? And my primary concern is the schools. We lived through a lot last year, and we cannot close the schools again. Of the 24 services that Baltimore County provides, which ones will specifically be affected by the state of emergency, whether it's restrictions or whether it's money that's coming into the government? I would really like to see it spelled out line by line. And then what conditions will allow for the state of emergency to end? I don't think it makes sense to enact it right now. And if you do pass this, I want to know when it will end. So I appreciate your time tonight. I'm listening to the conversation. I hope to hear my answers.
Well, Ms. Adams, thank you so much. Let me just say this, the state of emergency is going to go for 35 days, and then we will have another vote if that's necessary at that time. That's what I have to say there. The rest of your question, the only thing I will say is this, not to get into all the details. I hear what you're saying, and I really, really, really appreciate you taking the opportunity to testify today. What I would ask you is this: what is the harm? What is the harm in making sure we utilize every tool to protect the public, even if they don't want protection for themselves, to protect the public so that all of us can enjoy our life and all the freedoms we want, and be able to go to hospital with ill and be able to be seen. You know, when you get too caught into the weeds, when we talk about the statistics and this and that, I would just ask you to think about your own family or someone else's family. And that, it doesn't have to be, you know, a big number, because that's their family, their loved one. And that's what we're trying to do, take the necessary steps to save lives here in Baltimore County. And some people need direction and some people need rules, and that's what we're doing. So
Mr. Chairman,
Mr. Chairman? Yeah.
Mr. Chairman,
go right ahead, Councilman Katz.
yes, I have a question regarding the school system. I don't believe that these emergency powers extend to the school system. I believe that the Board of Education has that authority. Could I get some clarification on that?
I guess we can ask the county attorney or Mr. Bosworth to answer that. Let me just say this: I certainly understand the relationship with the Board of Education and the State Board of Education and their regulation over schools. But I do believe the state of emergency may give the county executive the authority to instill certain rules over all of Baltimore County, including the schools and any place else.
Is
That's
Mr.
my
Ben,
understanding.
is Mr. Benjamin there to clarify this? Because, I mean, we have no other power over the school system. Why would we have this power? That's all I really
I
want to
think
know.
I think that is the point. I think that is really the point, Councilman Katz. The point is when you declare a state of emergency, a lot of the other rules go out the window because it is an emergency. And during emergencies, you have an opportunity to do things and have certain powers you otherwise would not have had. I think that is the point with the state of emergency. Certain rules that you did not have or certain powers you didn't have, now the county executive will have. Now flexibility will be extended to other places because of the state of emergency, like the hospital. That's my understanding. If somebody, one of the attorneys want to correct me or someone want to correct me, I'm open.
Well, I would just say, Mr. Chair and Councilman Cash, that under 3-1-504 of the code, it speaks to the executive, county executive issuing executive orders that he or she considers necessary to protect the health, safety, and welfare of persons within the county. And it lists certain, enumerates certain things, 11 of them that he may, types of orders that he may issue. It's not exhaustive, but it includes those 11. So I understand that BCPS, Baltimore County Public Schools, they may issue, protocol, certain directives, but I do believe that as far as the code is concerned, it does not carve out schools. It gives the county executive the ability to issue executive orders that he believes necessary to protect the health, safety, and welfare. So it just gives him discretion. Councilman Cash, it's something that we can discuss more offline or as the week progresses. I'm certainly happy to do that.
Thank you very much.
Mr. Chair,
Yes.
thank you very much. I just want to ask Ms. Leister something, and I also want to commend the work the administration has done, specifically the Department of Health. This was just sent to me. I don't know if this is accurate, but hospitalizations in Baltimore County as of Saturday, October 28th, new admissions were 62, which was 8.29 per 100 beds, which was 11% decrease. Is that an accurate statistic, Ms. Leister?
So our data team goes for hospitalization usage per week.
Mm-hmm.
And according to the data presented this morning from last week, there was actually a 23% increase in hospitalization in the past week. That's not all specifically tied to COVID, but there is a demand on hospitals right now. And they are telling us that, and EMS is telling us that also. So there's definitely an increased demand. And we get that information from MDH utilization.
Okay, this person says this is from the CDC, so I'll have to get the source of this, but I appreciate you answering. Thank you.
Thank you very much.
Councilmember Marks, I have one other thing I want to say.
Sure.
In talking with the hospital executive, see, this is the point we're trying to make. Some of these individuals don't necessarily have to be hospitalized, which is true, because if they are sick but they still seek hospital care, it's still placing a demand on the hospital system. And that's what they're telling us is challenging for them, because they might not be sick enough to be hospitalized, stay in the hospital, but they may be sent back home, but they still had an emergency room utilization experience. The emergency room utilization numbers have gone up This is what the hospitals have been reporting to us for the last couple weeks. And the bigger issue for them is staffing. All of the hospitals have reported their concern and challenge around staffing. They're struggling with staff. So any increase in hospital emergency room visits or utilization. So it's not just about ICU or, you know, the critical care beds, but it's the people coming into hospitals, presenting for testing, may not be sick enough to stay, but the hospital system is still being impacted.
Yeah, I'm being told these numbers are COVID only related. I mean, we're entering the time of the year when you're likely going to get more hospitalizations, right? More people will be getting the flu, and
Correct.
the winter, you get a lot more.
Correct. But
illnesses.
the COVID piece is exacerbating it. And what was challenging, you know, challenging for me to hear is the fact that the number of people who did come in and had and tested positive for COVID and had to be hospitalized, the vast majority were unvaccinated individuals. But equally troubling for me are the individuals who came into the hospital and had been impacted or reinfected by COVID after being vaccinated because they were vulnerable. They were, I think they were in their 80s, the hospitalizations that were described to us. That's troubling to me as an administrator and a citizen, knowing how many seniors we have that got their vaccinations, but are now being impacted because there are unvaccinated individuals that they don't know of. They don't know that they're vaccinated. I mean, they don't know that they're vaccinated.
Yeah, so our positivity rate today is around 4.3%. That's right.
That's
Our
correct.
positivity rate.
Have to
Around there, right?
Like,
Okay.
Yes, this is Della. That is correct. And I just wanted to point out that actually the increase in hospitalizations of 23% in the past week are tied to COVID increases. But Ms. Rogers is correct. We've also heard that they are inundated with clients, but the COVID numbers have definitely gone up for hospitalizations. So the CDC information can be dated. This is dated as of last Friday, our data. Thank you.
So let me ask a general question. We've done a lot of things right here, correct?
Yes.
Our vaccination rate is over 70%, right? At least 70% of the population has gotten at least one shot.
Right.
I mean,
So
what else have we done?
That leaves 230,000 people that haven't gotten in.
And we continue to do this aggressive outreach. What more will it take to get that vaccination rate up?
I'm gonna tell you my personal opinion, what it will take. And I'll share a story with you real fast. I had a lady tell me her daughter would not get the vaccine. She begged her to do it. She begged her to do it for her grandparents. She begged her to do it for the safety of her mother. She begged her to do it for her own safety. She begged her to do it for her kids. What made her run out and get a vaccination right away? When she realized she couldn't go on a vacation without a shot. She said, I'll be right back. I'll go get their shot. So, you know, in my opinion, what it's going to take is to inconvenience some people and get them to think about some things they want to do. Like you can't go to the gym without a vaccine. You can't come to the movie without a vaccine. You can't come to work without being vaccinated. You can't. These are the things that's going to, in my opinion, get the rest of the folks, because we're giving away, I mean, the state giving away lottery money, millions of dollars, free this, 50,000 here, all of that, it's not working. Inconvenience people, hit them where they want. Like, I want to go on vacation and you telling me I can't go without a shot, they go get the shot. They don't, all those other things didn't work. That's my personal opinion. But let me just say one more thing, and I hate to bring this up. You know, once upon a time, I was a fire chief. I guess I'll be a fire chief for the rest of my life. And one of the things we teach people when we teach junior officers or new officers, when you're looking at a scenario, a situation, and things are moving in the wrong direction, you take steps. You don't wait for it to get so bad that you want to do something. No. When things are moving in the wrong direction, you start calling for additional resources. If you don't need them, you send them home. But you don't wait until things are so bad that's when you decide to do something. We want people, in this particular case, we want to make sure the county executive and Baltimore County government, the hospitals in Baltimore County, and anyone else who has different protocol as it relates to a state of emergency have the flexibility to do what they need to do in case things get much worse. Because right now, that's the direction we're in. And I pray to God that we make a quick U-turn tomorrow and we don't have to do anything. And I pray for all the people that's not vaccinated, the people that are vaccinated. I hope that none of them get ill and die. But where we are today, we have to take those steps just in case. And that's what we're doing. Any additional questions? Ms. Del Castro, our next speaker, please.
Our next speaker was Bill Adams, and I saw Mr. Adams on our attendee list earlier, but I do not see him on here anymore. So I'll go on to our next speaker, William Fuhrer, and then I'll go back to see if Mr. Adams is logged back on.
I wonder if that's
Mr.
Yes, I'm here. Hello?
Okay.
Yes.
Yes.
Yes, thank you, Chair and council members, for allowing me to take some time here. I don't want to re-echo a lot of the statements from Councilman Crandall, but what I've heard in the community, I'm very active on the east side in Dundalk and Essex, is the same things that he's repeating. Councilman Jones asked, what harm would this do for us to pass? I disagree with that statement. How about we reverse it and say, what good is this going to do for us? Because all we're doing now is taking away the ability, giving the county executive the latitude to make restrictions and changes with no oversight down the road. We have hospital numbers, and for an administration that touts its transparency, I found it very hard to get information on a whole host of things, development projects, code enforcement, permits, a whole bunch of things where the administration says they're better and more transparent, and they're actually not. The hospital numbers, I'd love to see them as well. Are they open to the public? And my question to Ms. Rogers would be, you said that you've only heard this recently from the hospitals. You haven't had this communication for the last year. So what we're going to do is we're going to declare a state of emergency so that a hospital can address staffing issues. How about an individual hospital, which I know they have the latitude to make to do that? So by enacting local legislation, what does this allow the hospital to do that they can't do right now? Allow overtime if they have staffing issues. It's a matter of overtime, so they can't authorize overtime or additional movement of individuals from one location to another location. So if the COVID was not here today and a hospital was having staffing issues, would we issue a county-wide emergency so that a hospital could address something? I find it highly doubtful that this is the only way that a hospital can address some of these things. This is the unrestrained access for the county executive and the administration to make choices for individuals. How about somebody from the council? If I ask all your members, if you smoke, why don't you raise your hand? Or if you eat sugary foods, should we police those too, Mr. Jones, and tell them that you can't go on a vacation if you smoke, or you can't go on a vacation or have access to go to work if you smoke? It's not the job of the county government to make decisions for people's choices for what they want to do individually. That should be left to them. This is unnecessary. Doesn't need to be done. I encourage everyone to vote against it. If there is an issue down the road and we have some sort of need to do mask mandates or social distancing, we can address it at that time with data. But the data that's in front of us now does not warrant any of these changes. And I think it's overreach. Thank you.
Well, I thank you very much for your comment. Certainly appreciate your testimony. And I don't smoke. I don't drink. But I certainly would protect your right to do so.
Mr.
However,
Chair.
there are
Oh,
certain
sorry.
rules that I think is important. And let me guess look at one thing here. I want to say For everybody that don't have the information, I would ask you to just type in Maryland COVID. You will get all the information you want in terms of hospitalizations. And what you will see generally, there's a nice chart that will show you that our worst period was back on like January the 15th, somewhere in there. And our best period since this all started was probably around June 1st or somewhere in there where we had very few cases. But then you will see that graph start to go up, up, up. And that's why we're here today. So, Councilman Dakota, and then we get on.
Thank you, Mr. Chair. I just wanted to address Mr. Fuhr's comments about smoking, eating sugary foods, and other habits. Well, you know, maybe that's an overreach for governance, but we can ask you not to drink alcohol and then get in your car and drive because you might hurt somebody. And I think that's a fair level of governance that we as governing bodies can implement, and then the police enforce it. And I think what we're doing here is similar to that issue where you can hurt yourself. And if you make that choice, that's certainly an individual choice, but then you're also making a poor decision in the potential for hurting someone else. So for Mr. Fuhr's metaphor, I would shift it around and look at in the view of drinking alcohol and then getting behind the wheel. And I think that's what we're trying to prevent with following the CDC regulations here and CDC guidance. Thank you, Mr. Chair.
Sure. I guess the other thing is 1,700 plus people in Baltimore County died. In all of the state of Maryland, that's one of the highest numbers, if not the highest. Higher than Montgomery County, higher than Prince George's County, 1,700 people. And all we're trying to do is save lives. And that's what we're here to do today. Next speaker, Ms. Belcastro. Thank you, Mr. Fuhr, for your comment.
I'm going to go back to Mr. Adams. He apparently is now on. Just a reminder to everybody, if you're signing up and registering to testify at any of our meetings, you have to be on with a smartphone or an iPad. If you're calling in by phone, I have no way of identifying you on the attendee list. So thank you for Mr. Adams for reaching out. Mr. Adams?
Good evening. Yes, I was connected by cell phone. I clicked the link to do it by WebEx. Thank you for taking a couple minutes to listen to me. A couple of thoughts across my mind. Number one, I'm completely against the emergency order. Mr. Jones, you asked, what's the harm? The harm in the emergency order is the restrictions that are unsupported, that are put on and never taken off. We've experienced that already. We experienced that as one example with youth sports in the fall when they were outright banned. The health department said they were leading spread of COVID. And I file a public information request, which Mr. Benjamin supported, and there's no data from our health department or our county executive to support the ban on youth sports. So by passing the emergency order, you're giving someone undue power who's already proven to be power-hungry career politician. It's not necessary. The same website that you looked at, Maryland COVID or MarylandCoronavirus.com, you could see the hospitalizations right on there. Again, hospitalizations related to COVID are very low. Hospitalizations related to all types of other stuff are very high. So this is unneeded, unnecessary. Our county executive, zero credibility, and neither does our health department. You need to vote against this and stop putting restrictions on people. The last point I'll raise, and this is going to happen because it's inevitable, everyone followed the rules, including me, right? You have 200,000 some people who are not going to get vaccinated, and this order won't make them get vaccinated. So we still have that problem. But now you're calling into question everyone's compliance going forward, because I certainly will not comply with the rules. And how many people are there like me? 50% of the people? What if it's even just 25% of the people? What are you going to do? So vote against this. Take care.
Thank you so much, Mr. Adams. Appreciate your comment. Okay, any additional questions or comments from the members? Is there, last call, is there a motion to approve resolution 112-21?
I'll move it.
I'll move it.
Second.
Second.
It's been seconded. Mr. Secretary, please call the roll on resolution 112-21.
Mr. Jones,
Aye.
Mr. Catch,
No.
Mr. Quirk,
Aye.
Mr. Marks,
No.
Mrs. Bevins,
Aye.
Mr. Patoka,
Aye.
Mr. Crandall.
The resolution 112-21 is passed.
Thank God.
You know, I just want to thank everybody for your time and attention, and thank the callers for calling in. Certainly appreciate your opinion. And any additional questions or comments before we look for any new business? Mr. Secretary, is there any further business to come before the council today?
There is no further business, Mr. Chairman.
Is there a motion to adjourn the meeting?
I'll move it.
So moved. Second.
Been moved and seconded. All in favor?
Aye.
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 Ayes have it. The meeting is adjourned. Thank you, and God bless each and every one.